now we are going to talk something very simple, that is nutrition. So what are the effectiveness of nutritional supplements in preventing AUD? So we'll be revising our biochemistry knowledge of first year a little bit. So alcohol and nutrition have a potential to interact at multiple levels. For example, heavy alcohol consumption can interfere with normal nutrition, resulting in overall malnutrition or in deficiency of important micronutrients by reducing their absorption and also by increasing their loss. Interactions between alcohol consumption and nutrition can also affect epigenetic regulations of gene expression. These effects may contribute to alcohol-related organ or tissue injury. And how does it happen? Basically, it affects all the systems, like increasing the intestinal permeability and increasing the severity of liver injury and liver disease, and also lung injury, brain injury, and immune dysfunction. Therefore, treatment involving nutrient supplementation may help prevent or attenuate some of the alcohol-induced organ damage. So basically, we are going to speak if a person comes to you, he's started drinking alcohol or is already dependent. So what are supplements you must keep to prevent further injury of the different systems? So this slide we all know from our MBBS time. What deficiency of what causes what. So I'm not going to repeat it. Just some important points. Like magnesium is deficiency will cause muscle cramps. Selenium we all know causes myopathy and cardiomyopathy. Thiamine causes deficiency causes Wernicke-Korsakoff and beriberi. Can anybody from the residents say what are the symptoms of beriberi? Anyone would like to answer beriberi? It's a very common thing. No one? So we'll come to it later. Vitamin A deficiency, everybody knows the dark adaptation, the rough skin, and vitamin C, scurvy with purpura, fatigue. Scurvy, anyone? Basic biochemistry.
Bleeding gums?
Yes, bleeding gums, very good. Yes, swelling gums, bleeding, and vitamin D will cause altered bone metabolism. Vitamin E is basically related to oxidative stress. And niacin will cause pellagra. Anybody pellagra?
Yes.
The triple D.
Yes.
Yes, please. Yes. You only. Yeah. The triple D. Very good. Death is one.
Death,
So folate and S-adenosyl methionine, they are related with the altered methylation and the epigenetic effects. So let's come one by one. Very briefly, we'll touch all the vitamins and minerals. So coming to the vitamin deficiencies, this is a long list of the B complex vitamins. We all know that this is the most common vitamin that we supplement whenever the alcohol patients come to us. We do write a B complex and specifically thiamine. So what does happen if these B vitamins are not there? What happens to these B vitamins in the alcohol patients? So due to decreased absorption, there is a deficiency of vitamin B complex in almost every alcohol. And the deficiency causes the following, like if thiamine is not there, Wernicke-Korsakoff, and if B2 is not there, then anemia and liver diseases are there. And if B3 is not there, then pellagra we already discussed. B6 is not there, then seizures, convulsion, anemia, inflammation. And for B9, it is a neuropathy and DNA damage. For B12, we all know depression is somewhat linked with lack of B12, and also antioxidant defense system is reduced. Now coming to vitamin B. Actually what happens is the hepatic storage is reduced, the intestinal absorption is impaired, and also there is abnormal metabolism of vitamins. So also the homocysteine metabolism is affected. That is, the conversion of homocysteine to methionine could not happen. So homocysteine levels will increase. The more the homocysteine levels you have, it can serve as a marker for liver injury, for your liver damage. And thiamine deficiency, as we all know, it causes cognitive impairment. So Wernicke and Korsakoff. So this is important for the residents. So Wernicke-Korsakoff is one of the important questions. To remember it, there is a short form that we have been using, COTRAC, confusion, ophthalmoplegia, ataxia, and thiamine deficiency. Basically, in one case, it is affecting the lower parts of the brain like cerebellum, brainstem, and mammillary body. And in case of Korsakoff, it is affecting the limbic system mainly, causing retrograde amnesia, anterograde amnesia, confabulation, and psychosis. So one case is reversible, but Korsakoff is irreversible. Unfortunately, since Wernicke's encephalopathy is a short-lived and sudden condition, 90% of alcoholics who develop it will go to Korsakoff psychosis, also known as wet brain. So these are the doses. All of us know it. Just for a summary. So obviously, if the patient has established Wernicke's encephalopathy, the dose needs to be a little higher. And if it is suspected, then like in established 200 to 500 milligrams 3 times a day for 3 to 5 days, then obviously followed by oral. And in suspected 250 to 300 milligram 2 times a day for 3 to 5 days followed by oral. In high risk of thiamine deficiency, 250 to 500 should be given 3 to 5 days followed by oral. And if the patient is at low risk with uncomplicated alcohol dependence, then oral supplementation would do. Now coming to vitamin C. So it has been seen that as compared to people who do not consume alcohol, urine ascorbic acid excretion increased by 47% after acute alcohol consumption. And if we supplement it with vitamin C, then we have seen that the complications of alcohol use disorder doesn't happen. A previous study also indicated that the chronic drinkers' blood levels can take up to 3 months to restore to normal vitamin C. Hepatocytes metabolize around 90% of ethanol, which is transferred to acetaldehyde, as we have seen in the previous lecture. And actually what happens is, this has been found in tissues including liver and brain, that poor ADH activity. By acting as an electron donor and thereby unleashing the NAD-NADH pathway, so vitamin C is supposed to speed up the alcohol metabolism. So when acetaldehyde produced has been associated with ethanol-induced hepatotoxicity, and when paired with hepatic CYP2 and E1 activation, these factors enhance the oxidative stress in hepatocytes. So when vitamin C is not there, oxidative stress will be more, liver injury will be more. So given the function of acetaldehydes in brain, dopaminergic stimulation of opiate receptors, also it becomes the biochemical basis of addiction. Now coming to vitamin D. We all know the role of vitamin D for bones. So when it is depleted because of alcohol consumption, we see immune system deficiency, muscle weakness, osteopenia, osteoporosis, severe upper respiratory tract infections, community-acquired pneumonia, and acute respiratory distress syndrome. So all these are common in alcoholic patients because of the depletion of the vitamin D. Now coming to the vitamin E. Vitamin E has a role in, it is an antioxidant and it prevents the stress, the oxidative damage to the liver. So it's vitamin E insufficiency has been long been linked to ALD. Vitamin E levels in liver of alcoholics with cirrhosis are frequently low, and it makes the liver more sensitive to alcohol. So vitamin C is now these days given as a supplement in addition to the corticosteroid therapy as a therapeutic option for patients who have already developed alcoholic hepatitis. So that was all about vitamins. Now coming to the minerals. So electrolyte and trace element imbalances are observed both during alcohol consumption and alcohol withdrawal because of the defective functioning of the renal tubules due to alcohol. The most common distortions are hypophosphatemia, hypomagnesemia, hypokalemia, hypocalcemia, and hyponatremia. It is crucial to provide either oral or IV supplementation of relevant electrolytes in order to reach their proper physiologic ranges. So we'll touch briefly all the minerals. So this is if whoever wants to see, I'm not going in detail, but the main problems that happens in magnesium is with cardiovascular and neuromuscular and central nervous systems. Anybody who can say what is Vostex and Trousseau-Saenz? Any resident? Vostex and Trousseau-Saenz? Yes, he is saying correct. The corner one. Vostex-Saenz and Trousseau-Saenz? Yes. Please be louder. The spontaneous carpopedal spasms that occur when we tie the BB cup. And what is Vostex sign? Yeah, we tap on the facial muscle extensions and you get spasms. It happens in case of deficiency of magnesium as well as in deficiency of calcium. So by testing, why I ask this question? Because by doing the simple two tests, you can know whether the patient sitting in front of you is in deficiency of magnesium, calcium or not. And also we know the role of magnesium in bone and mineral metabolism. Now coming to calcium, of course it has a big role in cardiovascular, prolonged QTC, cardiomyopathy and congestive heart failure, and also in neuromuscular excitability we can test by Trozius and Mostek signs. And in central nervous system also it causes generalized fatigue and depression to confusion. Coming to sodium is very important because a lot of patients who come to us in alcohol withdrawal or in detoxified in the alcohol withdrawal or this phase, they have a lack of sodium. So mild symptoms causes anorexia, nausea, vomiting, headache, muscle cramps. Moderate symptoms are muscle weakness, lethargy, confusion, and severe symptoms are seizure, altered consciousness, and coma. And in potassium, in case of potassium, its cardiovascular and muscular symptoms are prominent. So coming to phosphorus, we should keep in mind for phosphorus that hypophosphatemia can cause rhabdomyolysis in patients, and especially in acute alcoholism. And also one thing to be kept in mind in case of phosphorus is it is linked to hemolytic anemia as well as impaired leukocyte and platelet function. What is important in case of selenium is it is the oxidative, it controls the oxidative stress, the oxidative damage in case of liver injury. So glutathione peroxidase is a selenium dependent enzyme that protects the cell membranes and lipid containing organelles from peroxidative damage. And if this is not there, peroxidative damage will cause a lot of liver injury in a short span of time. And also it is important for the regulation of the thyroid system. And turnover rate of some neurotransmitters are also affected by selenium deficiency. Coming to zinc, so you can see the lesions, the skin lesions, the acrodermatitis, the decreased wound healing, and these are very common in case of zinc deficiency. Chromium has seen to cause type 2 diabetes and atherosclerosis. Now coming to dietary fats, recently there has been a lot of literature on omega-3 fatty acids and their role in alcoholics. So fish oil or purified omega-3 eicosapentaenoic acid and docosahexaenoic acid. And these are known for brain development and they are also beneficial in ALD. Now these are some of the articles if you want to study more about it, and here is a book reference, The Vitamin Cure by the Canadian psychiatrist Abraham Hopper. Thank you.